morning, everyone. Good morning, especially to our Facebook Live audience. We thank you so much for joining us. My name is Arden Garnett. I'm a member of the Gamma Pi chapter of Omega Psi Phi Fraternity Incorporated, serving the residents of Prince George's County, Maryland. Welcome to Gamma Pi chapter's monthly Health Initiatives webinar, which covers topics which affect our community. Today's topic is the importance of adult vaccines, and we're excited to have with us our guest speaker is Brother Dr. Jadan Phillips. Dr. Jadan Phillips is a board-certified family practitioner who graduated from the University of Maryland Medical School. He also completed his undergraduate studies at Johns Hopkins University. He is the chairman of the Omega Psi Phi 2nd District Health and Wellness Committee. He is also the vice chairman of the Omega Psi Phi International Health and Wellness Committee. He currently, is the associate dean, student and minority affairs at the Renaissance School of Medicine at Stony Brook University in Long Island, New York. Just before we begin, there are a couple of housekeeping items to mention. If you have a question, I believe there may be a way to type them into our chat box or the Q&A box. We will do our very best to answer your questions during the time allotted. Finally, this webinar is for informational purposes only. This presentation does not substitute consultation by your own doctor or healthcare provider. Without further delay, we welcome Brother Dr. Jadan Phillips. Dr. Phillips, the floor is yours.
Good morning. I guess I'm waiting for the host to let my video, turn my video on. But Good morning, Arden. I'm excited to be here. I think it's a critical topic at a critical time. I'm still waiting for my video to come on. It has to come from the host. You cannot start your video because the host has stopped it.
Okay, we're going to work that out here in just a minute. Thank you, Dr. Phillips. Folks, just please bear with us. We appreciate your patience. We're going to work out this slight tech glitch, and we'll get Dr. Phillips on video here momentarily.
Let me start. Will not let me start my video.
Okay, we're working. We should have it resolved here just shortly.
Here we go. Good morning. All right.
All right.
Sorry about that. Sorry about that.
Thank you, Dr. Phillips. Great to see your face.
Great to see you as well, Arden. You know, again, as I told you as we were prepping for this, I really look forward to this because I have had some very enjoyable experiences working with your chapter brothers over the year from Hampton University, Gamma Epsilon chapter. So yet another good brother to work with and do some great work. I'm very excited. I think this topic is something that's very important. You know, number one, unfortunately, we are seeing an increase in the number of COVID cases and flu cases. So the conversation of vaccine, which was a big issue during the pandemic, is still a big issue for us because, again, unfortunately, right now, we're still seeing, you know, I think as far as adults, right now, we probably have about 15% of adults have updated COVID boosters at this time, and about 34% of our seniors have updated COVID boosters, which again is contributing to these increasing cases and unfortunately increasing hospitalizations. And I think when we look at what happened during the pandemic, I think one of the things that unfortunately exposed communities of color was it has become obvious that preventive care is not one of our strengths. And it is not the fault of the people only. I think it's also, an issue with access to quality medical care, understanding the benefits of knowing your numbers. So when we talk about preventive care, one of the components of it that's very significant is your adult vaccinations. And like I said, the most immediate one when we think of it right now is dealing with the COVID pandemic and also the increase in the number of flu cases. So again, excited to talk about this today, my brother.
Awesome. Now, Dr. Phillips, a lot of us probably on this call, I doubt very seriously if there are a number of children on the call, and a lot of us have children. Can you maybe elaborate a little bit more on maybe some other things that we could do to maybe even understand that there are adult vaccines out there? I think there could be a portion of, especially in our communities, that may not think, they may think of just the COVID and the flu vaccine. So can you elaborate more on, those vaccines that are available to us that maybe we just quite frankly don't know about?
Well, again, I think that's a great point because we all remember when we were young and we were getting shots at every doctor's visits. But the interesting thing that happens as we get to the age of 18 or maybe even 21 is unlike when we were going to the doctor every year and the doctor informs you of the vaccinations we stopped going to the doctors for preventive purposes. Usually, you see those numbers drop pretty significantly in the 20s and 30s. So a lot of time, the whole concept of adult vaccinations is a foreign one because we're also foreign to the whole concept of going to doctors on a regular basis. But there are multiple vaccinations that play a major role. You have hepatitis B. Hepatitis B is a serious ailment that can affect your liver and it can compound a person's health problems. And for people that work in the healthcare field or have risk factors, it is a vaccination that is indicated and recommended. In addition to that, you've got human papilloma virus vaccine, which is HPV vaccine. Again, another vaccine that its purpose, because this type of virus, unfortunately, has a relationship in a risk for development of skin cancer. Pneumococcal vaccine. The pneumococcal vaccine is another one that is available and indicated in certain scenarios. And again, pneumococcal infections can cause pneumonia. They can cause central nervous system, spinal and brain infections. They can also cause blood infections. And these can be complicating factors, especially for someone who has other medical issues. Shingles vaccine is another one. The one that's recommended now is the Shingrix. But again, for anybody that's ever had shingles, it can be extremely painful and uncomfortable. And unfortunately, if it's severe enough, you can even have a situation where you develop a chronic pain situation. So again, those are just a few of them. I mean, you've got the Tdap, which again, if you are a person that's ever had a wound, they're going to ask you, have you had your tetanus booster in recent years? And it would be indicated because that can prevent infections that can complicate a wound that you might have. So again, these are some of the vaccines that are recommended. And when you go for your annual physical exam with your doctors, that is one part of the evaluation that occurs where whatever vaccines that are indicated for you, they're going to let you know. Now, I know in New York, sometimes we can provide these vaccines in the office at the visit, but unfortunately, sometimes with certain insurances, they will not cover it in the same way that they will cover it if you go to the pharmacy. So letting the patients know which ones they can get with me, which ones they should get in the pharmacy, that's also pretty important as well.
That is great information, Dr. Phillips. I just want to back up just for a second and talk about, you listed a number of vaccines, and perhaps just to touch base on each of them. You mentioned hepatitis B. Now, I have older kids now. So, I have a
So Brother Garnett was saying that he has older children, and you were talking about the hepatitis B. So I didn't catch
Yes.
the last part.
I'm so sorry. I was going to ask about the risk factors. You had talked about some risk factors for the hep B. Can you hear me okay?
Yes, sir.
Okay, great. Some of the risk factors involved. Can you elaborate just a little bit more on the risk factors for specifically just like the hepatitis B?
Well, again,
Why it's
the
important to get that.
hepatitis B vaccination is recommended for anyone between the years of 19 and 59. It's also recommended for individuals over the age of 60, if they have risk factors for the development of hepatitis B. Again, some people may have history of alcoholism causing some liver damage. Unfortunately, another and emerging big problem when it comes to the liver is fatty liver. Fatty liver is now emerged as one of the top causes of liver failure. So any of those risk factors, if you were to get hepatitis B on top of that, you could be in a pretty bad shape. So again, if you have those risk factors, or for example, if you work in a setting where you might be exposed, that's another indication for, you being at high risk and you being a person who would benefit from that vaccine.
Got you. And Dr. Phillips, I know we're not on a call with, where it's all 100% healthcare providers, but just even the word hepatitis, thank you so much for correlating that to the liver. Hepatitis, hepatic equals the liver. And I think oftentimes, again, especially our communities, we hear these big terms and sometimes it could go over some of our heads. So I want to, as we continue to have these conversations, I may be the captain obvious of as the host, just to make sure we just talk about the simplifying these terms so that if these are the vaccines that our listening audience are candidates for, they can know not only for themselves, but as they're having conversations with their healthcare provider to say, hey, maybe they have a history of or family history of liver disease or something like that. So I think it's important as well to understand these terms. Talking about the human papillomavirus, I know that this is a fairly newer vaccine.
Mm-hmm.
I'm in pharmaceutical sales. I remember launching the human papillomavirus vaccine. Can you just expand a little bit more about exactly what that is? What does that mean? Because that's a long term. Some
No
folks may
worries.
be thinking, "Ooh, what is human papilloma? Do I have that? What is that?"
Well, human papillomavirus is a virus that can cause warts. And a lot of times, unfortunately, these warts can be sexually transmitted. And unfortunately, one of the risk factors that is associated with having this condition is the development of skin cancer. So one of the reasons to get or indications to consider this vaccine is for someone who may be sexually active, because again, just by skin contact, you could expose yourself. And as I said, if you are exposed and then down the road develop skin cancer, this could have all been prevented if you would have gotten a vaccine. And, it's recommended, during the adolescent into young adult years, but you can actually be a candidate for this up until the age of 45. And again, I think, as we look and, consider people's lifestyles, and I'm not here to judge anyone's lifestyle, but I think that whatever lifestyle you choose, you want to make sure you're protecting yourself. And I think that, this is one of the ways to protect yourself. Just to backtrack 1 second, I think, you brought up a great point, which is important. And I am also in medical education. And as I teach my young up and coming doctors, one of the concepts that I make very clear to them is the whole idea of health literacy, which means that, like in my family, my father had diabetes, my grandparents had diabetes, my great-grandparents had diabetes, and if I was to call it diabetes, none of them would understand. If you called it sugar, they totally understood. Now,
Right,
there was a
yes.
question just now in the chat
Mhm.
about whether this is indicated for both or only for men or only for women. This vaccine is indicated for both men and women. And again, I think it's important, especially for the ladies and for persons that may have, certain types of sexual practices, because you could have manifestation of these warts and they can be internal. They can be inside your vagina, they can be inside your rectum, they could be inside your mouth. So you may not see them. And again, this is something that can turn into a cancerous condition, which could be very damaging and tragic at the end.
Thank you so much for sharing that. Doctor, and I'm going to get to this question too, that came. I have 3 boys, and so when the HPV vaccine came out, when my sons came of age, all 3 of them got the HPV vaccine. Now, I'm not condoning, of course, we want to teach them proper sexual health, but as a parent, it's like, hey guys, whenever they do start to become sexually active, that's another preventative way to protect them down the road. And the question did come out. I don't know if you saw Dr. Phillips, as we're still on HPV. Can human papilloma virus cause cervical cancer?
And yes, it can, because you can get warts on the cervix, and that can cause a transition into cancerous cells developing. So again, and these are things that we don't necessarily feel or see until things are too late. So as I said, that's why, I strongly recommend it. I have a 14-year-old, and he has gotten his HPV vaccine because, I'm teaching him to practice safe practices, when he becomes active. However, we still want to give him as many protective measures as possible.
Absolutely. And as we move on down, those are great questions. Thank you so much for those in our listening audience who are providing those questions. You talked about the pneumococcal vaccine that could cause, what could happen if you don't get it is, CNS challenges, blood infections. But someone maybe who may not be as, when you talk about health literacy, you see pneumococcal. Are you also talking about, hey, does that also mean if I get this vaccine, it's going to help to prevent me from getting pneumonia?
Absolutely. Absolutely. It can be helpful in preventing. And, one of the things that we are seeing, and we saw during COVID, is unfortunately a lot of chronic conditions linger in our community. And because of these chronic conditions, they can unfortunately complicate a situation. So say, for example, you're overweight, maybe you have some lung issues, maybe you have some heart issues, and you get pneumonia. That pneumonia could be complicated by those other conditions. That pneumonia could contribute to a heart situation. So again, if you are able to prevent or lower your risk by the vaccination, I strongly encourage it. And the best place to start to make these decisions on what you should or should not do starts to occur at your monthly or your annual, preventive visit with your doctor.
Great point. Great point. And so moving on to the shingles vaccine. Now, Dr. Phillips, we've chatted about this. I know Brother Dr. Ford, some of the other brothers on the Health Initiatives Committee. This is kind of near and dear to me personally, because recently I had I would say a small case of shingles. I was treated for shingles, and as you said, and really it should be a slap on the hand for me, because I did not get the shingles vaccine, and if I would have, it could have probably saved me some heartache. Now, to your point, can you just elaborate more on the shingles vaccine and with Shingrix, And I understand, and correct me if I'm wrong, there may be multiple doses that you have to get with the shingles vaccine. And could you just expand a little bit more about shingles and how someone can get shingles? Because I think there may be some misunderstanding about how you can even get shingles.
Well, shingles is associated with the chickenpox virus. And again, the shingles is caused because this virus lurks in our neurologic system. And it can come out, it could be stress, it could be anything that can trigger it. And that virus can affect a certain nerve. Now, depending on the nerve and the distribution that that nerve supplies or works in, that can dictate how severe or not severe the shingles virus is for you. Now, I've had patients, everybody talks about the sciatic nerve, one of the biggest nerves in the body. It innervates probably your whole leg. A patient of mine had shingles in that nerve and she couldn't walk and then developed chronic pain that required her to take medications. So the Shingrix vaccine, which is the one that's highly recommended at this time because it's much more effective, is a 2-dose vaccine, which means that you're going to get 1 dose of vaccine initially and then follow up in about 6 months for the second dose. The 2-dose system, one allows your immune system to first start to mobilize in recognizing this vaccine and its ability to create an immune reaction against shingles. The second dose is going to optimize that activation of your immune system because, Brother Garnett, let me be honest with you, just because you had shingles once doesn't mean you won't get it again if you're not vaccinated. And unfortunately, sometimes the distribution or the severity of the case can be much worse the second time you've had it. So again, you know, for anybody that's had shingles, it can be very painful and uncomfortable. And again, if we can avoid this with a vaccine, I would strongly recommend it. You know, the vaccine, other than, you know, causing some soreness and some viral, you know, some fever and chills, maybe a little bit more the soreness in the site where the vaccine occurs. The site, you know, the vaccine works very, very well. And the one that is recommended is the Shingrix vaccine. I saw there was a question in the chat about, oh, and last thing, with the shingles vaccine, it's recommended in individuals 50 years old and over. Just to backtrack a moment, going back to the pneumococcal vaccine, there are multiple types or strands of the pneumococcal vaccine. You've got the Prevnar 13, you've got 15, now you've got 20, and you've got 23. Again, it's usually recommended for individuals over the age of 65. For people under the age of 65, this is pneumococcal. It is for individuals that may have risk factors, immunosuppressive conditions, heart disease, lung disease, obesity, diabetes, these things like that. Again, and the shot should be, if you get the 13 or the 15 first, you would get 23 about a year later. And then if you don't need another 23 unless there's more than 5 years before you turn the age of 65. If you do turn the age of 65 before that, then you would get 123 before 65, and then you would get a second one, which would be your last after the age of 65. But if you've gotten a 20, you know, that is a newer modification of the pneumococcal vaccine, and that is a one-shot deal in itself. Another risk factor when you're considering the pneumococcal vaccine is definitely smoking history.
Okay, that is great information, and you had answered I know what came up about when to get the shingles vaccine. I believe 50 and over. When we're talking about the Tdap, you know, with wound care, you know, tetanus shot, I guess a lot of folks think, you know, the rusty nail. I got bit by, you know, a wild animal. I got bit by a dog. outside of those, are there any other risk factors or any other candidates for a tetanus shot, where they should get a tetanus shot? And
Well,
and just like I guess with the line of questioning from, what's the age that you should perhaps get a tetanus shot? Is there just a time where you should just get one anyway, or is it on a as needed basis?
well, again, the tetanus shot is part of your childhood vaccine series. It's then recommended around the age of 11 or 12. And then usually you're recommended to get a booster every 10 years. Now, that may change if you have a wound. That could adjust you having to get an additional booster. The other indication for it is usually with pregnant women between the age 27 weeks gestational age and 36 weeks, they're recommended to get a tetanus booster. Now, tetanus, the tetanus, the TD versus the Tdap. TD refers to just the tetanus and diphtheria. The Tdap refers to the tetanus, diphtheria, and pertussis, which pertussis is the virus that is responsible for causing whooping cough. So again, it is something that is recommended if one of those specific scenarios would occur, but also, routinely every 10 years, and your doctors usually, and it's a lot easier now because we have the electronic medical record, we keep a list, a record of your vaccine so that when that 10-year mark comes up, we can update you at that time.
Gotcha. Now, Dr., if I could go back just a little, and you had started off this webinar by talking about the flu and COVID and how there are increased rises in those cases. In the flu vaccine, there's some people who may not be able to get it because what my understanding is that some flu vaccines contain maybe egg or some of the ingredients in vaccines. So for people who may have some kind of allergy to, say, let's just specifically talk about the flu because we're in the middle of the flu season, what should they do?
Well, again, it depends on the severity of the reaction. If they have a severe, which they would call an anaphylactic type reaction, unfortunately, they would, not be a candidate for that vaccine. Again, the flu vaccine is recommended from 6 months up. There are two types. You have an inactivated type, but you also have a live attenuated type, which is more a nasal spray and not an injection. Usually you recommend the live virus in people under the age of 50 because of the risk of it causing an immune reaction, and people as they get older, unfortunately, are at a higher risk. So that's why you try to avoid people over the age of 50. I recommend getting the flu shot. For people that can't get it, I think one of the things that we saw during the pandemic is that a mask can make a difference because we saw those numbers drop. I think the other thing you can do, there's some vitamins that we can, that can be helpful in boosting our immune system. Vitamin C, vitamin D is helpful with respiratory function. Zinc is also helpful. So these are some supplements that you can use. And then the other thing is, again, being mindful of situations that may not be safe. If you're not feeling well, maybe it's not a good time to go be in a large group. If you are a person who's vulnerable and the family wants to come over and visit you, again, if somebody's not feeling well, maybe they need to wear a mask coming to visit you. And, maybe they need to take other precautions. When we start to look at, when you go to your doctor's office, there's two types of flu shots that we're giving. There's the quad variant or quadvalent type of flu vaccine, and that's for individuals under the age of 65. The high dose flu shot, which is one of those that we give as well, are for individuals over the age of 65.
Okay. That was a question that came out of the chat. Thank you so much for answering that. So as you talk about gatherings, a lot more folks are traveling, are getting together because a good portion of the population has been vaccinated, boosted, they've gotten flu shots. So a lot of folks now are beginning to travel more. And some folks are going out of the country because, well, number one, it's wintertime and they want to go somewhere warm. Are there any vaccines that folks should be getting if they're traveling, especially if they're traveling outside of the United States?
Absolutely. A couple things. When we talk about international travel, now in the times of COVID, you got to look at what the COVID rates are, and those numbers are usually available of where you're going to. The other thing I would recommend is the CDC, which is the Center of Disease, the Central Disease Center of Disease. I forget what the C stands for.
Control.
But control. But in any case, their website has a functionality where you can say, I'm traveling to Tanzania. You can go search Tanzania and they will let you know the recommended vaccines that you should have. Because again, the other thing is this: who wants to go to Tanzania or someplace exotic and get malaria, or get sick with some other ailment that you could have prevented? I think, with COVID, we see how complicated getting very ill abroad can be. And if we can avoid that by having proper preparation, at 87, you understand what proper preparation and planning do, and what it can prevent. So we can exercise that same type of activity before we travel. Now, if we're talking about national travel, which is throughout the United States right now, I think it's imperative for all of us to really look at what are the COVID rates where we're going to travel. Because if the COVID rates are higher, say if you come from a place where the rates are lower and you're not wearing a mask, if you go to a place where the rates are higher, you might need to adopt some different protective measures to, keep you and your loved ones safe. So again, you might need to wear a mask. If you're, I'm still a person, even though it's not mandatory, when I take a plane, I got a mask on the whole time in the airport, on the plane, just to protect myself. So I think that if you're going internationally, check out the CDC website and look at the place where you're going, and they give you recommendations for these vaccines. Now, you can go to your doctor, but sometimes they may not have all of these vaccines like yellow fever or things like that. So you may need to be connected with a travel doctor, which is a special type of doctor that specializes in infectious diseases, but also specializes in providing vaccines for international travel. If you're going to be traveling nationally, again, the internet has provided us with some resources where we can find out what are the flu and COVID rates where we're going to, so that we can take the appropriate precautions. Because again, in the past 2 weeks, we have seen at least a 30% jump in the number of cases, and unfortunately also in the number of hospitalizations. And as we've seen earlier on in this pandemic, as the hospitalizations go up, the concerning thing is, are we going to see a jump in the number of deaths? Because that is something that was following. So again, it all comes down to me, and we've got to recognize what our risk factors are. So as a man who's over the age of 50, I'm not in the same shape I was when I was 25 years old. So I've got to make sure that I exercise a little bit of caution, because I am not in the strong place that I would be when I was younger. If I'm a person that has obese, that has high blood pressure or heart disease or diabetes, what are you doing to offset your risk? And that includes considering vaccines. That includes, making sure you're up to date on your preventive testings and evaluation so you can identify what your risk factors are. But also, the thing that we've seen during the pandemic, because of the closing down of everything, people fell off on their preventive maintenance, meaning, I ran out of my medications. I don't feel that bad. I'll see the doctor when I see you. And now we may have 6 months, a year of being off of blood pressure medicine. And that could be a scenario that could set one up for a stroke or some other complicating factors. So I think, again, it's important for all of us to really get back to really recognizing how we each need to be on top of our preventive health. And again, I'm not here to force people to get vaccinations, but I'm saying as you look at yourself and assess yourself, you got to look at all of the tools that are available to you on the table so that you can know what you're saying no to if you decide against it, but also understand what's available to you if you decide to utilize them.
Dr. Phillips, I'm glad you touched on a number of things there. I think going back to what you said about number one, health literacy. I know it's been talked about so many times, and I know this is not the platform to get into a health literacy talk. Perhaps we'll have one at a later time where the Gamma Pi chapter could do that. But about the pandemic did cause a lot of folks, yours truly included, to you missed the doc, you weren't even, some doctors they were doing the telemedicine things, which I know is important, but what it sounds like as well is that if we haven't already, perhaps before the year is even out, and I know some folks healthcare may still have some healthcare coverage, maybe they've reached their deductible or they haven't. It sounds like as well, even though we have a few weeks left in this year, that there could be many of us on this call who need to get in to see our doctor and have these conversations to talk about where we are health-wise, to check our blood pressure, to get blood work done, to ask about, hey, I've gained a few pounds. Does that make me obese, overweight? Because I think a lot of times folks who, let's say, for example, I'll throw myself out there, I'm a big guy. And sometimes big guys, or even guys who may be small, or guys and gals, I know they're both males and females on this call, who may think, oh, I just gained a couple of pounds. And they may think, oh, I'm just a little overweight. They may not think that they're obese. And I know that when you're a little heavier, it can compound other things. So just by you sharing that, I think hopefully will light a fire under some of us here who are watching this to say, you know what? Let me get my butt to the doctors and just get checked out before going into the new year. Because the other thing too, as you said, you don't want to go on these trips and you plan these vacations, and God forbid something goes awry that could have been prevented or addressed prior to leaving if you had seen Dr. Phillips or our own Dr. Kevin Ford. So we really, I don't know if you wanted to add to those things.
I think again, unfortunately, I have seen people who have played with fire, meaning, I'm not on top of my diabetes. I went to get my pedicure before I went on my trip and they cut my toenail too close. And now I look like I got a little sore and I'm going to Italy and go shopping with my daughter. And I had that patient come in and I had to put her on antibiotics. And I said, that still might not help you because your diabetes is not controlled, and unfortunately that person had to go to the doctor in Italy. And I'm not saying that Italy has a bad medical system, but you're not able to use your insurance, which again, if we have to pay for medical care out of pocket, that's pretty significant. And like I said, it was something that was preventable. We talk about high blood pressure being the silent killer. I can't tell you how many people that I knew of, that had strokes during this pandemic because they were off their blood pressure medicine, that had heart attacks and even died or had other type of cardiac issues. Again, because they may have been told, hey, you have high blood pressure or elevated blood pressure you need to follow up on. Now we have this pandemic and we've got this time and space that unfortunately isn't going to make the problem better. It's just going to create this veil that unfortunately, when it's pulled back, you've got a big issue. And the big issue can be something that can really adjust your life. But I think the last thing I wanted to state, I think that it's important for us as healthcare providers. And again, you mentioned Dr. Ford earlier, we work together, and he too is someone like myself who believe in connecting with people on a very basic level. Because when people understand what you're talking about, they're more likely to comply with what you're asking of them. And we look at, why people were vaccine hesitant during pandemic. It wasn't just, them going or having awareness of the Tuskegee experiment or Henrietta Lack. It was also their experiences of maybe going to a medical provider who talks at them and not to them and doesn't explain things in a clear way. So as I entered this space of, just community health education, even though I may be one who has always practiced health literacy and making it simple and plain in the language that I use with my patients, when I engage people and they obviously had some residual issues from their experiences, I had to own that, even though it wasn't mine, so that we can start someplace new. And I think all of us as healthcare providers have had to own how the medical profession hasn't always been respectful, especially with communities of color. So we've got to regain our trust in that space, not only Jadan Phillips and Kevin Ford, but also those medical students that I talk about that I'm educating that may be healthcare providers so that we can do a better job. So if there's another pandemic and say we're offering another novel, type of treatment like a vaccine that was just developed, we've got a better connection with our population so that people aren't so untrusting. And I say untrusting in a way where it's like, well, why did I give you a reason to not trust me? But I understand their reasons for not trusting.
Sure. I think that's so important. I've been fortunate to work as a pharmaceutical rep over the years, and I know I've had countless interactions with some phenomenal physicians, and then I've had some not so great conversations. Perhaps some bedside manners are better than others, and I think that's so important, Dr. Phillips, as you mentioned. I don't know if Dr. Ford wanted to chime in as well, but for those of you who are watching, if you're not happy with your provider, what it sounds like, Dr. Phillips, is either, keep them more accountable, demand more of them, or find someone else who's going to really meet your needs. And it should not be a reason to stop going. It's just a matter of finding that right physician who's going to be in cahoots and on the same page as you, where you can share your history and be open, and also that provider will tell you the things that you not just want to hear, but that you need to hear. I know I've been fortunate. I won't tell who my physician is, but he's always been very, I can share out, and they will always say, hey man, listen, you need to tighten up on this because I'm concerned about this, this, and this. And to have
just to continue what,
yeah.
No, I think it's important. I think, as you prepare for your visit, I think you need to have your questions. If you get stage fright, I welcome your wife or husband or loved one in the office to make sure that your questions are answered. I think, again, I'll say it like this, to see me for a physical exam can cost your insurance maybe $300-400. And if you and I were going out to a dinner where we were spending $400 on a meal, will we tolerate dirty silverware? Will we tolerate water not being filled on the spot? So we have to be just as demanding to our healthcare providers, because this pandemic has shown that we're not in a great space as a country health-wise. And I'm not saying it's the doctor's fault, but I'm saying that the doctors are part of the solution, and also the patients. And to get the most out of the relationship, you've got to make sure that you demand the most out of the relationship. I have patients that have that family member that may be the bad cop. I don't mind that, because I know that person is going to make sure that their loved one gets everything they're supposed to. because it's amazing. I remember my father, who was the most outspoken person that I knew. I never saw him apprehensive about opening his mouth. But as I got older and would go with him to his doctor's appointments, this was his answer to every question. And then we go outside. I'm like, Pop, did you understand anything that dude said to you? He says, you heard him, you know, you understood it. So if you understood it, I understood it. Again, unfortunately, in his ending, he didn't understand as well as he should. So, you know, I think it's important. And as a healthcare provider, one of the things that I do at the end of the visit is I'll say, hey, Arden, you know, when you get home and talk to your wife and kids about what we did today, tell me what you're going to tell them. And you can tell me in the same language that you would use at the house. And this is just to make sure whatever points that I've tried to emphasize that they've understood it. Because if they have a misunderstanding, I can correct it at that point in time so that they're not operating on bad information. Because again, listen, Dr. Ford is here and I know he heard it like I heard it. In the beginning of COVID, what did we hear people saying? Black people don't get COVID. And that probably put us to 3 to 4 months behind the 8 ball. And as we see with a pandemic, 3 to 4 months could be the end of somebody's life. Imagine with diabetes or a cancerous condition or things like that, if you're operating on bad information or misunderstanding.
Yeah, great. Great point. And I think everything that we talked about, I know we kind of moved off of, we were talking more about just some general health, but I think it's important as it ties in to these adult vaccines. I know the topic is, about adult vaccines. I just want to make sure everyone who's watching and is tuned in to know that these kinds of questions, to Dr. Phillips' point and Dr. Ford, correct me if I'm wrong, but even when you're talking about these vaccines, to say, to make sure that we, as the patients, we're on the other side of a Dr. Phillips or Dr. Ford, that we really, really understand prior to leaving that office, that we're in full understanding of what our healthcare providers are sharing with us. And if we don't know, don't let them run you out the room, or we should be like, whoa, wait a minute. I don't understand that. Help me, or this is what I do understand. Is that right, Doc? And the doctor's either going to say yes or no, that's not what I said or not what I meant. Okay, well, run it back to me. We have to be keepers of our own health. That's a great example, Dr. Phillips, and thank you for letting us in even with your own personal experience with your father.
Definitely. And usually what I'll do too is I will sum up our visit, right? This is what I'm getting ready to do at the end. I'm going to increase your blood pressure medicine. I changed this. I changed that. Now what, and have like you said, have the patient repeat it back to you. And then that way, that they heard what you were saying, right? And so definitely it's about communication. It's also about, I always tell patients, I'm a sports guy, right? I'm the coach. You're the player, right? I said, we want to win a championship, and you can't win unless we both compete, right? I have to be able to tell you the proper information. You have to run the play.
Yeah.
If you don't run the play, we're not going to win. And winning is your life. That's what we're talking about. And so, that's one of my things that I like to impart on the patients, that we both have to be able to work together.
Wow,
I think Dr. Ford, brings up a great point. And I think this is, when you can get primary care physicians, because unfortunately, I think our health system doesn't really appreciate the importance of primary care physicians. And people get out here in the world and may have an issue. Like Monday, I'm going to have a hip replacement. If I didn't have my primary care physician to refer me to the orthopedist, no matter what the pain I'm having, I'm not going to be able to get a procedure. If I need a colonoscopy, if I need, if you need to engage the medical system, you've got to have a primary care provider. And it's important to do so because it allows you to operate and maneuver as you may need. Because again, we've all got lives, we got families, we've got jobs, and that involves coordination when you have to plan on things. So when you have that Coach, as Dr. Ford just says, it allows you to plan on things so that other priorities in your life don't have to suffer. So
Right.
I think it's important to make sure we're at the end of the year. Have you had your physical? You know, is it time to make your new physical with Dr. Ford or Dr. Phillips? You know, and what are the things that you have to be concerned about? You know, if you have questions about the vaccines that may be indicated, if you have questions about, do I need another COVID booster? How is that blood pressure that I've been dealing with? Am I on top of it? That cholesterol issue, am I doing well? Did I get my blood work done? If I'm over the age of 45, have I gotten my colonoscopy yet? You know, or some type of equivalent test. If I'm a Black male or a male in a high-risk category over the age of 40, have I had appropriate prostate screening? You know, and for all of us, how's my mental health? And again, these are spaces where we can check on those things and sort of come up with, like the coach said, a game plan on how we can win the championship.
That's right.
Those are
That's
great.
right.
And you mentioned some of those things. We've been fortunate with the Gamma Pi chapter to have had some of those other talks. I know we had a mental health talk, that there are a lot of the talks, some of the things you mentioned, Dr. Phillips and Dr. Ford, are available still on our Facebook page. So once we conclude today, you can go back and look at some of the history of these health initiative talks. We keep them on our Facebook page. So for those of you who are listening, we have kind of a history of some of those talks like we're having now. This will be recorded, and you'll be able to go back and review them again. And I think for a lot of it, in just an hour's time, a lot of information has been presented here. Go back and listen to this talk again. Go back and listen to the mental health talk. Go back and listen to many of the other topics that we've had in the past. And that's part of our outreach here, and that's why we do these every month. So they're super important. And as I said before, we're here to serve the community, not only in Prince George's County, Maryland, but really throughout our country and throughout our world. I know we're getting close to the time. Dr. Ford, was there any other? Well, first of all, let me say this, Dr. Phillips, on behalf of the Gamma Pi chapter, and for those who have been listening, we really appreciate you taking the time out, because you're about to, if you all didn't hear him, he's having another surgery on Monday, hip replacement again on Monday. So for this great brother to take the time out and to do this just kind of shows just how important this topic is, and about making sure that he's still doing a service not only to the citizens of Long Island. Dr. Phillips is in Long Island, New York, and he's really affecting really folks all over the country and the world. So we want to thank you. We really thank you for this time. Dr. Ford, of course, we thank you. Dr. Ford's here in PG County, and we thank for those of you who tuned in today. Are there any last remarks that you want to say, Dr. Ford?
Also, Dr. Phillips is running our second district health initiative. And we also have webinars during that. Dr. Phillips, you're going to give us an update on that?
Absolutely. Again, we have webinars dealing with a variety of mostly preventive but relevant medical issues. We usually are on the last Wednesday monthly on the YouTube platform, and we'll be sharing those advertisements. Our next one is going to be, I believe, on the 20th or the 30th of December. And we're going to be talking about HIV and AIDS, because this month is HIV and AIDS month. In addition to that, because it's the holiday, we'll be providing an update on COVID, because the numbers have increased and the hospitalizations, and now we're dealing with this potential tridemic, which is not COVID only, also the potential of flu, and also RSV virus, which is respiratory syncytial virus, which is another virus that's out here, can affect young people, and can unfortunately create a scenario where a person could have all three of these conditions simultaneously, which could be, unfortunately, a very deadly circumstance. But I think the other thing that, this activity is, and the things that you alluded to of what I am doing and what Dr. Ford is doing is how healthcare providers during this pandemic, especially us in Omega Psi Phi, have recognized the importance of us to pivot to become community educators, become community, advocates because of what we're aware of that had been going on in our community as far as lack of trust, skepticism, people being tired of just not being treated appropriately. And we saw as the pandemic was emerging that voices like our own are trusted voices. And even if you got a hip replacement on Monday or other things you got to do in life, you understand. I mean, that's why I got into it. And I'm sure Dr. Ford can also relate of reasons that he got into medicine. So, I feel like, this is our Super Bowl. Like in New York, for law enforcement and firemen, when 9/11 came, that was their moment where those gentlemen and ladies stepped up in a major way. And this pandemic has showed me as a healthcare provider that, this is a way that I can give back in a major way. So I'm very humbled and honored to be here. I'm excited about the ongoing webinar series that Gamma Pi has been having and will be having. And I encourage you to participate in our audience. In addition to that, please join our second district, monthly webinars, which are going to be on the last Wednesday of the month, and join us for the subject matter that we'll be having there as well. So with that, thank you so much, my brothers.
Thank you. And so if there are no further comments, I see there are no other things in the chat. We want to thank once again the audience for tuning in to Gamma Pi's Facebook Live webinar series. We look forward to you tuning in again the next time. And we wish everyone a very Merry Christmas, a happy holidays, however you celebrate. And also we wish you good health. So thank you all so much. Again, Dr. Phillips, we appreciate you. Dr. Ford, as always, thank you so much. And our technology team behind the folks behind the scenes that you don't see.
Salute to the tech team. Salute to the tech team.
Very important. Thank you all. And thank you, ladies and gentlemen, once again for joining us. Have a great rest of your Saturday.
God bless.
All right.